Hi, my name is Casey and I'm an occupational therapy student at Kaiser University. In today's video, I will be debriefing this week's simulation by answering some questions. The first one is, how is preparing for the pediatric group activity different from preparations that you made for the adult interview? For the adult interview, it was mostly going over the questions and studying the questions so that you wouldn't be lost whenever you were conducting the interview, and then completing the interview. It was not something that you needed like hours of preparations for, because it was just studying the questions and then conducting the interview. It wasn't it was asking questions. And with adults, you can kind of expect certain situations to occur. You know what can happen. With the pediatric population, it's more preparing by research, conducting research, evidence-based articles on what activities to provide, conducting research on strategies that you need to be aware of, because with the pediatric population, you need to expect the unexpected. There's many different ways that the situation can go, so just a lot more preparation in that area. So the second question is, what challenges do you think you will experience when conducting your group activity via video conference with the pediatric client? So I think there's many things that will be difficult, but the main one for me, I believe, is keeping the client engaged through video conference, keeping that attention there, because even when you're in person with a client, it becomes difficult to keep them engaged and focused. Number 3, what are some strategies that you can employ to overcome those challenges? So, like I said, we need to conduct research and identify strategies. So, one strategy that I can provide is always keeping my instructions, directions, my sentences short, keeping them short and to the point. Maintaining an upbeat type of behavior, my emotions to be a little bit more dramatic, just overall more upbeat, and providing activities that I think will be fun, but at the same time occupational based and therapeutic. So just just think outside of the box with the child. Always, redirect, keep going with the activity. If I see that they're getting bored, their attention's not there, ask some questions, keep them on their feet. So these are some strategies that I apply with my clients, and I will apply during the video conference. Number 4, do you feel that communicating with the pediatric clients is easier or harder than communicating with adult clients? In my opinion, since I work in this setting, it isn't as hard, because I feel that I feel that I'm so comfortable and used to this already. In another person's shoes, stepping in other people's shoes, I feel like adult populations would be a lot easier to communicate, since their attention is there, or depending on the diagnosis. But most of the time you can communicate just the way I'm communicating in this video. It's very simple. With children, you need to be upbeat, you need to be enthusiastic, you need to be kind of at their level of active, so it is it is difficult to communicate with children, because you can lose their attention really quick. You need to remember their vocabulary, their educational level, their cognitive level. So it is difficult. Number 5, what are some strategies that you can use to assist in enhanced communication with the pediatric clients? So, like I said, you need to keep it short. You need to keep it simple. You need to make sure you understand their vocabulary level. Keep your level of words not so difficult, so that they're, you want to include some words that are more difficult for them, because that's the way they learn. But just don't make the situation so hard. Just provide the just right challenge. That's what I go by all the time with the pediatric population. If you provide an activity that is too challenging, you're going to lose them. If you provide an activity that is too easy, then you're going to lose them as well. So it is difficult, because you need to provide the just right challenge, and then provide simple directions, to the point and just maintain a positive and happy environment overall, so that the child will want to participate in the activities that you're providing. So I think this concludes the questions for the debriefing this week. I hope that you enjoyed my video and learned some strategies that I provide in my therapeutic sessions. So yeah, thank you for watching this video.